Hello, I'm Dr. Aisling Coy and I'm a consultant rheumatologist in Salisbury. I'm going to talk about how axial spondyloarthritis is diagnosed, or SpA for short. We essentially use a combination of symptoms, findings from a physical examination and various test results to assign a degree of probability for making the diagnosis. But I have to say that even for an experienced rheumatologist, this can be quite a tricky process. It presents very differently for each individual, so for some, I appreciate the process may be quite frustrating as it can be lengthy, involving multiple visits and seeing lots of different healthcare professionals. The symptoms you tell us about are so important, and back pain being the most common feature. But it is the nature of the back pain that is so crucial, and it is back pain that appears to be inflammatory in nature. We will also ask you about other inflammatory type of symptoms, such as other joint involvement or tendon involvement, and also psoriasis of the skin, anterior uveitis, and bowel symptoms. We will also ask about triggering infections, such as food poisoning or sexually transmitted infections. A physical examination will focus on movements of the spine and the presence or absence of other features that suggest inflammatory disease. Investigations for SpA can really be quite confusing to interpret. Inflammatory levels in the blood may be raised, but this is a very non-specific finding, and the type of test used throughout the country can vary. We may also request a blood test for an HLA-B27 gene. This is one of several genes found in SpA, but it is the most common one. However, the presence of this gene is by no means diagnostic for the condition, and about 7 to 8% of the population of healthy individuals in this part of Europe have a positive test. So although there's a really strong association with SpA, its presence is not diagnostic, but equally its absence does not exclude the diagnosis. Imaging in this condition can be really useful, and we're likely to request an X-ray of your lumbar spine and your sacroiliac joints. This is before we would do an MRI scan. Most places now have an agreed protocol for MRI scanning that looks specifically for inflammatory changes in the whole spine and sacroiliac joints. However, again, these tests are by no means diagnostic. In addition, your rheumatology department may refer you on to see other specialists, such as a dermatologist, ophthalmologist, or gastroenterologist. In summary, I really hope that I have outlined how complex it can be to make a diagnosis of SpA. We use lots of pieces of a diagnostic jigsaw puzzle to confirm, sometimes watch and wait, or exclude the diagnosis based on each individual's presentation. The NAS symptom checker is a really useful starting point in your SpA journey. Thank you for listening.